I'd just like to start by thanking everyone for giving their time today and taking time out of your busy schedules to join us for this webinar. So this topic is one that's really important to everyone at OnCall, and I'm sure to the providers that we work with as well, the ethics of virtual care. Providers find themselves now in a place where it's increasingly difficult to provide care without the use of some kind of technology or without at least some virtual components. It's nonetheless incumbent upon providers to ensure that the tools they're making, or that rather they're making use of, don't compromise their ability to provide ethical care to their clients. So I'll just have some main points up on the screen, but if anyone does have questions at any point, just feel free to put them in the chat and I'll address them all as we go along or at the end of the webinar here. So basically the purpose of this webinar is to just guide providers through some of the main ethical issues that we've been made aware of during the time that we've operated in the virtual care space. So OnCall's operated for about 2 years with over 1,000 providers working with us in Canada and the United States. And it's, it can be very difficult for providers to use technology in an informed way, as it's often unclear or completely untouched terrain in terms of having a set of standards of care or ethical guidelines that relate specifically to using virtual tools. So this is something that we felt was really important to address directly with providers, especially as it's going to be increasingly important for providers to understand the ethical ramifications and potential issues that might arise from making use of these tools in their practice. So today we're going to go through some of the main issues that you might face as providers and to provide some recommendations for how to make sure you're operating ethically. So yeah, once again, if you do have any questions as we're going along, please just enter them into the chat. And if you haven't muted your microphones, please do so now, and we'll move right along. So access is global, but licensing is not. So we're living in a time of increased access to technology, which is a fantastic privilege. This can enable individuals to connect where previously it would have been too difficult or inconvenient, and it's really never been easier. All you need is a webcam and a microphone and internet connection, and if you have a smartphone, you really only need Wi-Fi or data. So new technology like virtual care platforms, video conferencing, messaging, online appointment booking, these are all pieces of technology that contribute to increased access and convenience. So virtual care has increased convenience for, in a variety of situations for both clients and providers. So for clients, it's beneficial if they live in rural areas or if they have difficulty making arrangements to receive care, like people who have to negotiate transportation, who might need to take time off work to meet their provider's schedule, or who need to arrange for childcare. Providers are also much more able to give care to clients that were previously unreachable or who had much greater difficulty accessing care. Having access to a virtual care tool in one's practice can also increase the income for individual providers by streamlining the process of collecting fees like no-show fees or cancellation fees, and by reducing the number of appointment cancellations due to external factors like bad weather or any other inconveniences. So for providers who travel to see clients, this can also reduce transportation costs, for example, if they're doing house calls and things like that. So increased access to care is unquestionably a good thing, but it's also important to be mindful of the limitations. So increased access can expose providers to increased risk, as clients can request appointments from almost anywhere in the world if they have access to internet. So it's vital that providers remain prudent when reviewing intake forms or any other tools that they use to collect patient information to make sure that they're not accepting clients from outside of their jurisdiction, because this can have serious legal and ethical implications. So to elaborate on that briefly for anyone who doesn't know, to ensure care providers have met educational requirements and that particular standards of care are going to be upheld, providers join colleges, and the colleges are then responsible for creating and maintaining guidelines for providers to ensure they operate within their bounds with all clients. It's very important for that reason that providers understand their college requirements and the limitations of whichever license they have, and that includes the physical boundaries in which they can practice to avoid any issues that might come from accepting clients who are based outside of their jurisdiction. Privacy matters. So obviously it goes without saying that privacy is a foundational aspect of any patient-provider relationship. So providers need to exercise caution when integrating a new platform into a practice, because this can potentially have a negative effect on their relationship with their patients if they integrate a new platform, but then they lose information, or files don't send, or if their information isn't protected, et cetera. So to prevent this from happening, providers should make sure of two key things prior to selecting a virtual care platform. So firstly, it's important to align one's practice with tools that reflect the nature of the work being performed. So for example, using video conferencing tools that aren't compliant with relevant privacy or health information laws that can expose patients and providers to undue and unnecessary risk. And we'll talk more later about what the potential ramifications of this are. But for example, in Canada, we have PHIPAA and PIPEDA that are two pieces of legislation, and in the United States, they have HIPAA, which those are all patient health and personal information laws. So a platform that's compliant with these laws is going to do a better job of protecting and securing people's information. So one real-world example of a non-compliant tool is email. So this is one commonly used tool that's not secure in terms of transmitting personal health information, but nonetheless, many patients and providers use it to discuss private or confidential information, and this could potentially be seen or obtained by unauthorized parties. And if something compromised that information, it could cause harm to both the patient and the provider. So unless the service is explicitly compliant with privacy laws or patient health information laws, it shouldn't be assumed that it's a private or compliant channel. So, number one, choose a tool that aligns with the nature of the work that you're performing. Number two, when selecting a virtual conferencing tool, providers should ensure that their security needs align with those that the platform provides. So kind of following up with number one, providers are responsible, obviously, for making the security and the functionality of the platform completely clear to their clients. So providers have to take certain steps to ensure there's clarity in the process for their clients from beginning to end. So letting clients know or making it clear that they're going to be asked to consent to online services and then fill out an intake form. From there, the information will be stored by this company in this way. So that way, you're going through the process with them. Those are just some examples of how you can kind of walk people through the process. And your clients will be assured that they completely understand what they're signing up for when you're working with them on a virtual care platform. The potential limitations of virtual care is something that should also potentially be discussed to ensure that clients are prepared to participate in online video counseling and to make sure that the client's receiving the most appropriate care possible. And so this is kind of a nice little segue into our next topic, which is one size does not fit all. So it's important for providers to ensure they're not advancing telehealth services or any other kinds of services on clients who desire or would benefit from in-person or other methods of care. Virtual care is best in our experience when it's used as part of an integrated when it's an integrated part of an existing practice, like accessing distance clients during periods of inclement weather or for check-ins while providers or clients are away on vacation. So in our experience, clients will generally follow the advice of their providers in terms of what type of care their provider thinks they should be receiving. And for that reason, it's important to check in with your clients to ensure they're still benefiting not only from the care itself, but from the medium through which it's being delivered. So mixed care is an option as well. This is a mix of in-person and online care. And this can often improve client-provider relationships by increasing the number of potential interactions between clients and providers. So there's a lot of different ways that you can organize your workflow to make sure that everything is working for you and your clients. For example, if clients are having a difficult time leaving their house, which is impacting their attendance for scheduled appointments in your office, it can be beneficial to offer a therapy that's not as dependent on one physical location, like video conferencing or a messaging appointment. And on the other hand, some individuals prefer the connection that they experience by coming into a brick and mortar office space or that feeling of having a dependable routine. So therapists should really strive to find a balance between providing in-person services and virtual care to make sure that their clients are receiving the most, appropriate care. In addition, clients should all be aware of all of the solutions offered by their providers. So in some extreme cases, malpractice charges can be warranted if helpful tools were offered by the provider or their clinic, but the client wasn't made aware of them. And then as a result of not being made aware of those offerings, harm or damages were incurred. So there's some precedent for that, legally speaking, and it goes without saying that it's better just to be upfront about all of the services that clients can potentially access. So, reasonable understanding. So everyone's favorite topic to talk about, legal jargon. So let's discuss a term that is going to be very important to any providers looking to offer virtual care in their practice. So reasonable understanding, what does that mean? This is a legal term that's used to help differentiate between varying degrees of competence and action in a given situation. So the clearest definition that I could find that wasn't just full of more legal jargon is up on the screen here, and I'll just read it to you quickly now. So what is reasonable depends on the facts of each case, including the likelihood of a known or foreseeable harm, the gravity of that harm, and the burden or cost which would be incurred to prevent the injury. In addition, one may look to external indicators of reasonable conduct, such as custom, industry practice, and statutory or regulatory standards. Okay, so what does that mean? Effectively, what this means is that providers must exercise some foresight. So is it likely that the person will come to harm based on, the situation at hand? Have I taken reasonable steps to prevent harm? And if not, how bad was the harm caused? How much would it have cost to prevent the harm that was caused? And how do others in my industry handle similar situations? And if we're mandated to handle such situations in a particular way, how is that mandated? So these are all just questions that providers can ask themselves before entering into a relationship with their clients, either on a virtual care platform or even just in general. It's just a good thing to remember when you're incorporating new tools into your practice to think about really all the ways that your clients and your relationships with your clients can really be affected. So some other factors that might be considered in defining what's considered reasonable are whether or not a person exercised a standard of care that would be expected of an ordinary and prudent person in the same circumstances to avoid liability. So we're going to talk more about standards of care in our next section here. But basically, the important thing to remember is that there are a number of factors which can influence legal decisions when harm comes as a result of, a provider, and in this case of using a virtual care platform, this can manifest in many different ways. So causing harm might look like advancing virtual care services on someone who might have benefited more from another type of therapy. It might look like improper use of the platform or using a platform that isn't secure, for example, and the reverse can also be true for any offline encounters that you have with your clients as well. So that's all the scary stuff out of the way, all of the legal implications. But there are many ways that providers can protect themselves from situations like these from ever happening. So one main thing to keep in mind is that providers who are seeking to incorporate virtual care into their practice have to be aware of the fact that having reasonable understanding of the platform is an ethical requirement. So you just need to understand exactly what kind of service you're offering for your clients when you sign on to a new platform. So I can't speak for all platforms, but for example, OnCall Health offers, a complete training to any new providers who sign on with our platform. So it's just important for providers to know how the platform is operating, especially insofar as it's going to affect your clients and any of their personal health information. So a good way to go about this in general might be to take a course in delivering virtual care services, of which many can be found online, and your college might also have recommendations on where to do this. Providers should also ensure that they're comfortable and competent with communicating electronically with their clients if they're going to be using a virtual care platform. It sounds obvious to say that, but it's just a good thing to make sure that you're comfortable using the medium that you're signing on with. Your clients as well should also have a reasonable understanding of what the platform is, why their provider's using it and what they can expect to gain from using it. There are many steps that providers can ensure clients go through to make sure their understanding of and consent to the platform is obvious. So like offering a consent to online services form, terms and conditions, a privacy policy, and making sure your client has ample opportunity to opt out of the platform if that's something that they would like to do. So, standard of care. 2 more definitions, I swear, but then we're done with definitions. So standard of care refers to a standard of practices accepted by professionals in the care community. Standard practices are determined by what an average practitioner having the same or similar education and training would do in the same or similar conditions. And if anyone wants references for any of this, by the way, I can send you our full list of sources that were made for this presentation. So don't worry about copying down definitions or anything like that. These practices are context-based for standard practices, so it can be difficult to know prior to checking in with your college or regulatory body what the specific standards of care are for something like virtual care. especially when many places don't yet have standards or guidelines in place for this. So like I said at the top of the presentation, established standards of care for virtual care haven't fully developed yet. A lot of places still don't have them, although a few places do. And of the places that have them, a lot of them haven't, they're not widespread or universalized. So it's important to check in with your specific college or regulatory body to make sure you understand exactly what their expectations are. So one aspect of standards of care is ensuring that clients are receiving the same, similar, or improved care to what they would be if they were attending in-person services. So if you're having, a video conferencing appointment with someone, you need to make sure as a provider that they're getting the same or similar or improved level of care to what they would be receiving if they came into an office somewhere. Other conditions for standards of care should be identified as well, like how is content experienced online? So do your clients understand what they're seeing and hearing when you have a video call or a messaging conversation? It's important that clients are referred from one type of care to another when it's appropriate for them to be. And there should also be some kind of backup for any technical malfunction. So the provider should make sure, if they can't meet me for my in-person appointments, I have some other way to reach them, or vice versa. If they can't reach me on my phone, maybe we have a video call instead. Or if we can't video for whatever reason, then we can message or something like that. It's always good to have a backup. So establishing access to virtual care as a part of overall ethical considerations is something that is likely going to be more universal in the future, but for the time being, these are just recommendations about how to make it easier on yourselves and your clients when you're going through a virtual care platform together. So any failure to meet standards of care can be considered negligence and grounds for legal proceedings and damages. So it's just important, once again, to be mindful of one's college requirements and the factors that we've outlined here, but definitely contact your relevant regulatory or governing body for any guidance on specific standards of care for your practice or region, and for specific standards of care if they're available on virtual care specifically. All right. So boundaries. Regardless of the medium or of the treatment that is being offered, all care-related interactions should take place as though providers and clients were meeting in brick-and-mortar offices. So this is what most providers are going to be the most familiar with, is setting up clear boundaries in a physical office space with a client that they intend to be seeing, on a weekly basis or on a bi-weekly basis going forward. But, a lot of people take for granted that when you're not in a physical office space, that because you're at a physical distance from your clients, then you still have those boundaries in place. But there are a number of ways that boundaries can be crossed or misinterpreted, even at a physical distance, if providers aren't cautious or if they don't properly educate their clients on how to use virtual care tools. So let's look at some of the ways that boundaries can be confused or crossed and how providers can prepare against that. So it's important that providers begin setting boundaries early on in their relationship with their client. From the moment you begin working with them, it's important, that the platform reflects the nature of the relationship. So you want something professional. You want something that can't be confused with platforms on which, clients might have casual encounters. So I'm not going to name any specific platforms, but there are plenty of social media and networking platforms or video conferencing platforms that people, have casual or friendly chats on. And using these tools as a part of your care practice can be confusing for clients who are, I'm used to using this with my friends, or I'm used to using this in a non-professional setting. So choosing a platform that meets the needs of your relationship and reflects the nature of your relationship can definitely reduce confusion and ensure that boundaries are clear from the outset in that regard. Having access to a virtual care platform can also increase the flexibility providers enjoy in providing services. So you can kind of make your own schedule to a certain degree, depending on, if you're a solo practitioner, if you work for a clinic, having a virtual care option can allow you to kind of make your own schedule. But this flexibility shouldn't be extended to the nature of discussions with clients. So there's sometimes, like I said before, that feeling that when there's a physical boundary like distance, we're protected from being able to cross boundaries or having those boundaries crossed. But it's still important to set up clear boundaries, even for virtual conferencing, even for a messaging conversation, to make sure, clients can't mistake it for being a casual virtual encounter of any kind. So with respect to specific virtual features, messaging is one good example of, where boundaries are very important. Clients shouldn't expect their provider to be available 24/7, like if it was someone they were texting. And unless the provider has set up a specific window for messaging, the client shouldn't have continuous access to message their provider over and over unless the provider has specifically initiated that conversation. It's just important to be able to protect yourself from constantly needing to be available to your clients. And that's just one example of a tool that some clients might think is like texting or something like that. But it's good to set up those boundaries in advance. From the provider standpoint, it's also important to regulate yourself in terms of boundaries for self-care, for example. Personally, I'm like a notorious overworker. I'll try to work when I'm sick or on vacation, but it's really important to set clear boundaries, especially over virtual platforms, to make sure you're guaranteeing yourself space when you need it. So it can be tempting to work when you're sick at home because you have access to all of your work still on your computer, or when you're on vacation because it's mobile and you can take it anywhere you go. But it's good to just make sure you're setting those mental boundaries and also boundaries with your clients to make sure that you're not going to be available 24/7 just because you can theoretically take your work with you anywhere you go. So basically setting clear boundaries about the way the platform is to be used and how interactions are going to be maintained from the beginning of that relationship with your client is the best way to ensure clarity and consistency throughout the relationship. So just to review before we get into questions, we've covered a few of the most important ethical considerations with deciding how to incorporate virtual care in an ethical way into your practice. We understood that access is global, but licensing is not, that privacy matters, that one size doesn't fit all, what it means to have a reasonable understanding, and to practice standards of care, and then finally, the importance of setting boundaries. So at this point, I definitely will open it up to any questions if anyone has any about implementing virtual care ethically into your practice. Okay. I'm going to give it another couple of minutes, but so far I don't see any questions. So if everyone can see on the bottom of their Zoom page there, they can see that there's a little chat bubble, and they can just enter in questions there if they have any. Okay, I'm getting the impression that that was all pretty straightforward for everybody. Oh, I see Rochelle has raised her hand. Give me 1 second here. Okay, Rochelle, I'm going to, oh, I think you're unmuted there. You can feel free to ask your question.
Okay, good. I finally found the chat button. Yeah. I'm wondering if OnCall has a pamphlet outlining their services that we could use with our clients, maybe download, print off, as opposed to having to create our own.
Yeah, absolutely. So something like in terms of something you could send out to your clients to just let them know what OnCall Health services are and, kind of like what they're about.
Yes, I was thinking more like a handout that could guide some discussion.
Yeah, absolutely. So, perfect. Yeah, absolutely. We definitely have a bunch of resources like that in our library of support guides. So if you go to, I can definitely email this to you afterwards as well, but at support.oncallhealth.ca, we have a bunch of guides like that where with even a couple of like downloadable posters that you can just print out or email to your clients if you'd like to.
Okay, thank you.
Yeah, no problem.
I love that it's sent an email form as well.
That's yeah.
Nice. Okay, thank you.
No problem. Okay, great. Perfect. So once again, we will make this recording available on the OnCall Health blog. So that's just oncallhealth.ca/blog, or if you're in the United States, it would be the same with .us instead of .ca. So oncallhealth.ca/blog. And thank you so much, everyone, for your time. And we hope to see you at the next webinar.